The next speaker is Dr. M. Thambidurai.
Chairperson, sir, thank you very much for giving the opportunity to discuss the very important subject. Especially, we already faced a lot of problem, the second wave of the corona in India. The COVID-19 pandemic in India is a part of the worldwide pandemic of the corona disease 2019. Sir, it is a known fact that it's originated in China and spread throughout the world. But at the same time, we have to see that China has taken a lot of efforts to control the corona disease pandemic, that they have successfully done it. But why other countries are not able to do, that is another problem we are facing now. Especially as of May 2021, India has the second highest number of confirmed cases in the world after USA. So much patients we are facing the problem. So I congratulate, first of all, as our Shiva said, the doctors, nurses, paramedical workers, and civil servants of the government administration has taken a lot of efforts to tackle this pandemic. Because without their help, we cannot succeed. They have taken the risks of the life. We have to congratulate them what they have done. So at the same time, sir, what our honorable member said, health is a subject of the state government. It is known fact. State has to do certain things because they are having the infrastructure facilities to tackle this problem. At the same time, center has to come forward to help the state governments. Then only we can tackle this thing. Because this disease is internationally a worldwide disease. State cannot tackle this thing. I also congratulate our Prime Minister has taken a lot of efforts to tackle this. He made so many speeches to make awareness about the disease to the country, the whole country. We have to pride of that. Our Prime Minister has taken so much efforts in that. At the same time, he has taken the risk of his life, visiting the labs where the vaccines are producing. Especially, he visited Pune Institute and also Hyderabad Institute. And see that we have to, especially when we are manufactured in India, it has to be produced and given to the people free. As some of the friends said, there are 3 prices are fixed. That has to be must be free. Because this kind of vaccination must be given to all poor people, all the people. That is our Prime Minister also recently announced. Nearly 90 crores, I think, vaccination going to be produced and given to the people. That kind of efforts, whatever Prime Minister is taking, we are congratulating him and his efforts. We cannot criticize anyone. Because what can the central government do certain things? Because without the help of the state government, they cannot do anything. Therefore, sir, and also to tackle this thing, not only vaccination. Vaccination is very important. Without vaccination, we cannot control this disease. As our friend of Shiva said, where in the Tamil Nadu also, the Chief Minister requested to take that vaccine producing center, the Chengalpattu district, that has to be given some importance. Because during the first phase also when we are seeing, our Tamil Nadu Chief Minister Edappadi Palaniswamy has taken a lot of efforts to control this pandemic, giving free rations. Sir, already you know very well, when our Madam Amma was as the Chief Minister, introduced free distribution of rice. Because our friend said we are having a lot of production of the food grains. That has to be reached to the common man to tackle this kind of situation. Because they are struggling, they are not having any money nowadays. It is only first you have to create some kind of service and confidence among the people that government is with them and giving this kind of help to the life of the people. Second thing, sir, community discipline. This is more important. Because our country is a democratic country. We cannot force, as China, what they are doing there. We have to make awareness of the disease. But our Prime Minister is highly, many times, giving in the speeches, Man Ki Baat and everything, he has made many speeches. That awareness must be, it is our responsibility, the elected people, our responsibility to see that the people must be aware of the disease, how to control it. Because everybody is wearing this kind of mask. But if you see, most of them are keeping outside only. The namesake they are putting, they are not covering the nose or the mouth. That is, this kind of, they are not serious about this. The doctor, you would have seen that most of them are putting masks. But they are getting, so I am telling sir, this is very important because regarding the vaccination is very, very important, I said. The first dose was given. Second dose, when they are going to get, nobody knows that. The people are fearing, after getting the first dose, sometimes they are telling 28 days is gap is enough. Somebody 6 months is enough. This kind of giving information, it's not creating any confidence to the people. We have to see that, as others members are suggested, and also our Prime Minister taking a lot of efforts, we have to cooperate and see. We have to produce more vaccine in India. Even necessary, as Prime Minister already cleared, to import also, that can be also done. Therefore, vaccination availability is more. This is the only solution for control disease, not any other things. And also people's participation, awareness to put mask, as you are sitting there putting mask, as I am putting here. I am always without mask, I never used to speak. Therefore, this kind of effort, I hope that our Honorable Central Government, our State Minister, new Minister, as guided by Honorable Prime Minister, will take all the efforts and see that India can be succeeded in controlling this kind of COVID thing, as other countries like China, even though it's a big country like our India, they are controlled more or less. We have to see that what sort of things they are doing also. And not only that country, in other countries, whatever the lessons we are getting, that can be used to control this. And we have to save the people of India. Then this is our must aim. There must not be any politics in that. That's why thank you very much for giving the opportunity.
Thank you, Dr. Thambidurai.